Well, hello class, and welcome to Module 5. During this module, we will be discussing pediatric neurologic dysfunction disorders. There are a good number of neurologic disorders in pediatrics. We will be talking about a few of them. We will be talking about intracranial pressure, increased intracranial pressure that is, seizures, neural tube defects such as spina bifida, and meningitis. And also hydrocephalus, or water on the brain, or increased pressure in the brain. So when you're completing your readings for this week, think about, number one, the differences that you will notice in a child's neurologic function than that of an adult. And what would the nursing implications be for that? And then when you're reading about increased intracranial pressure, or that high amount of fluid in the ventricles in the brain of a child, think about, again, the pathophysiology of this disorder and how children at different ages might present with this condition. And then be thinking about what are some of the therapies that we use for increased intracranial pressure. Neural tube defects, or spina bifida, is one of the common ones that we think about. Thinking about what the nurse would need to do in support of children and their families when they have neural tube defects like spina bifida, and how would nurses manage these disorders. Children may have VP shunts, what is called ventriculoperitoneal shunts, and that goes from the ventricle in the brain to the peritoneum, or the abdomen. And these VP shunts are done for hydrocephalus routinely, again, where there's increased water in the ventricles, which can lead to increased intracranial pressure. And this shunt then shunts the fluid from the ventricles to the peritoneum. So can you think of what would happen if this shunt became infected, or if it became clogged? What would the symptoms of the child be? Well, they would start showing signs of increased intracranial pressure again, and those need to be taught to the family so the family can recognize that, because that is a neurologic emergency. Also, meningitis we're going to talk about during this module. And many cases of meningitis are now prevented, thankfully, because of the Haemophilus influenza B vaccine, which is called HIB, the HIB vaccine. So luckily, many cases of meningitis are now prevented. Before this vaccine came out, there were a lot of babies that suffered from the HIB meningitis. Now, other cases of meningitis still do occur, and so we do need to still be aware of that, of how to recognize meningitis, those signs, so the child can get care very quickly, because it can lead to devastating effects. I mean, the child can die from meningitis, but they can also have lifelong hearing loss and many other things that can happen. So we need to recognize what meningitis looks like and how to treat that. And then lastly, seizures. We're going to talk about in this module, and seizures can be especially scary for parents to watch their child have a seizure. I mean, no one wants to watch a seizure when it's a loved one, but especially in children, a seizure can happen simply by a fever going up very rapidly. So it's not the height of the fever, it's not that, well, when could a seizure happen? 102, 103, 104. It doesn't mean that. It means how fast the temperature rises. So it can go from 99 to 101, but super fast, and that can be enough to stress out the brain and cause a seizure. So luckily, those seizures are usually a one-time deal. They usually don't have more than one febrile seizure or a fever seizure. But there are other cases of seizure disorders like epilepsy, which are a chronic illness and cause repeated seizures. So working with families and helping them understand how important it is to make sure the child takes their medication, make sure they're safe when they have a seizure, make sure you're not putting anything in their mouth, those types of things. So as you will see during these modules, we're going to talk about these different disorders. We're starting off with neurologic, but we're going to progress through all the systems. And as you see, we'll need to understand how you talk with families about these disorders. And so you will be completing patient education videos, where you will pick a topic and you will teach them about this. And that's it. So have a great week. Bye-bye.